Welcome, Joslyn Center Facebook Live fans. My name is Jack Newby. I'm Executive Director of the Joslyn Center here in Palm Desert. Welcome to our interview Friday. Before we start with our interview, I wanted to let you know a few things that are happening here at the Joslyn Center. So, of course, every Friday here at the Joslyn Center, we either have Penny's Pantry or our senior farmers market. So we invite you, especially with the higher food prices that we're seeing. And if you need to supplement your food budget, you can come to the Joslyn Center on either Friday mornings and partake in Penny's Pantry or in our senior farmers market, and they are all free. For our Meals on Wheels program, if you know someone who needs a home delivered meal, they're homebound because of surgery or other health issues, we have a Meals on Wheels program in Palm Desert, Rancho Mirage, and Indian Wells. And so if they would like to receive our services, have them give us a call at 760-340-3220 and ask for Bob Elias. And also, if you would like to volunteer being a Meals on Wheels driver, we certainly need more of them during the summer because many of our volunteers leave for the summer and go back home. On Friday, May 26th, we have our Age Well Drive Smart program, and that's presented by the California Highway Patrol. And this is a free class. It's taught by a CHP officer and a senior volunteer. And it's about a 1-hour course, and it teaches you as we drive and get older, you know, sometimes we get into bad habits. So it tells you about some of those habits, some of the changes in the laws that have coming up, and how to keep safe while driving. And you get a certificate of completion, which you could present to your insurance company, and it may very well lower your insurance rates. And that's always a good thing. Also coming up is our Joslyn Center Spring Health and Wellness Fair. And that's on Wednesday, May 31st from 9 a.m. to noon. And we have medical seminars, glucose screening, blood pressure screening. It's presented and sponsored by Desert Oasis Healthcare. So they'll have their healthcare vehicle here and be able to do those sorts of tests there, blood pressure screening, as well as seminars on various health issues and opportunity drawings for the attendees. Coming up in June, we have Brain Boot Camp. That's a 2-session course, June 13th and 20th. And Brain Boot Camp was developed by the UCLA Longevity Center. It's a great way to learn things, how to maintain your brain health, and also ways and tips and tricks on how you remember things. And finally, our Aging Mastery program that starts on Friday, June 2nd. It's a 5-session course every Friday. And you learn positive aging by focusing on key aspects of health, finance, relationships, personal growth, and community involvement. So the Aging Mastery program was developed by the National Council on Aging, and it's a great way to, if you need help in those areas, it's a great way to find expert help. Each program has a short lecture by an expert in their field, such as sleep or finance or healthy relationships. So you get that expert input in that class and then learn how to incorporate that into your own life. So without any further ado, we do have an interview this Friday, and that's with Christina and Stephen from Terra Healthcare. So they will be joining us in just a moment. There they are.
Hello. Good morning.
How are you both this morning?
Amazing.
We're doing good.
So why don't you introduce yourselves?
Okay. My name is Christina. I do home health and hospice intake here.
I'm Stephen Betts. I'm the Director of Social Services and Community Development for Terra Home Health and Hospice here in the desert.
So tell us a little bit about Terra Healthcare and what you do. You just touched on it briefly, and then we'll delve into it a little deeper.
Okay. So Terra Home Health and Hospice of the Desert, simply put, we are focused on providing life-changing services to the residents of our community. We go throughout the desert. We have therapists, nurses, aides. They will come to your home or wherever you reside.
So we have a lot of home health or home care agencies that provide companion care and medication reminders and that sort of thing here in the desert. How are they different, or how are you different in terms of your home health care as opposed to the more the less health focused agencies?
Okay, so a home health care, in the sense of personal care, that's caregiving that would come into the home that you would pay for privately. Those are individuals that can help with aging in place, personal care, chores, service, meal preparation, transportation issues, getting you to the doctor, and you know, companionship, which is really important as we age in place. The difference between our services and them is ours are all skilled services. So all of our clinicians are either physical therapists, occupational therapists, RNs, LVNs, social work, chaplaincy. So we work under the guides and orders of a physician. So the care that we would be providing in the home would be physician guided care, meaning whether it's home health, we're going in to address a wound, or you've had recent hip and knee replacement and you'll need physical therapy to come in the home. That would be something that would be provided by our services. And then on the other side, obviously that palliative care, end of life, hospice care. And those are all what we considered skilled care, and those are covered by Medicare or private insurances. So a lot of times those kind of in-home care agencies who we work with very closely are not done under the guise of a physician. They're more private kind of duty care. So that's kind of the difference between us.
And why is home health care important? What advantages does it have for the patient or your client?
I think the main important thing about home health is that it's specifically for people who do find it difficult to leave their home or either can't leave their home at all. So a lot of the things that therapy and nursing does in a normal healthcare setting can be done in your home. Specifically if you can't leave. And this is a whole group of people in our community that are struggling and need this help, that either don't know that they have it or don't know how to get it.
And to touch base on that, there's been a lot of research done that's proven that patients that are able to heal in the home actually have better results, you know, because they're in those surroundings with their things and the therapies are coming into the home. That not saying that they're not going to get results in the outside in the community, going to like outside physical therapy, outside nursing. That's not what I'm saying. But they, as opposed to actually being away from their home receiving care, they could actually be at home, and we see better results. People want to be at home, and patients have the right to choose where they want their care. And so I think that's one of the things we do, is we advocate for those patients that would like those therapies inside their home, as opposed to being in like a skilled nursing environment.
Well, we know for many people that perhaps would remain in the hospital if they weren't able to receive some of the care that you're able to provide, or would remain in a care facility if they're not able to obtain your care. And you know, sometimes you have to be mobile. You have to be able to get out and drive a car, or have someone drive you to outside physical therapy, and a lot of times people don't have that option or ability. So you know, it seems to me that, you know, more than convenience, necessity, really it's an important part of a person's health care and their recovery if they're receiving your services following surgery or an injury.
Right. Yeah.
So tell me a little bit about hospice. A lot of people seem to be afraid of that term, or or afraid of hospice. Tell me what it is and why people shouldn't be afraid.
Okay. So hospice is end of life care, specifically for those that have a life expectancy of 6 months or less. And that is not like a hard stop. Some people stay in hospice a lot longer, sometimes a little bit shorter. It's all depending on the person. Being on hospice, the difference with that versus home health, it doesn't necessarily mean that you are homebound, just that you are experiencing a sort of decline and you are in those end stages of life. But it is a very scary topic. It's a scary word. We completely understand that. It's a hard conversation to have with people. However, in that time of their life, that's almost when they're going to need the most support. Both the person and their family are going to need a lot of help. So with hospice, we do nursing. We take care of all the medications and the refills. We provide medical equipment, anything that's needed. And we're here to navigate those really hard times and to have those conversations with people and their families. And it's important that the conversations do happen, because if you're too scared to have them, you could be missing out on a lot of things that will help you in a really, really difficult time.
It is a difficult time, and you mentioned family. What sort of services, and many people don't know, hospice also can provide some services for the family. What sort of services do you provide to help guide the family through what is a very difficult period?
Okay, so hospice, the whole tenet of hospice is like providing care for the patient and meeting the patient where they're at, right? So be it in their home, in a facility, and in the hospital too. We don't do a lot of general inpatient, but the idea that we're at this point in the juncture of this human's life, we've acknowledged, the family has acknowledged, and the medical team has acknowledged that left untreated, the patient would probably pass within 6 months or less. And once that discovery is realized and vocalized, then the hospice team kind of moves in, and it's a multidisciplinary team. So it's the nurse, the social worker, the chaplain, the physician, the home health aide, and a volunteer. So we're addressing the needs of not only the patient, but also the needs of the family, right? So those things that have left to be unsaid. Is there paperwork that needs to be addressed, meaning end of life paperwork, power of attorneys, et cetera? Or is there personal relationships that need healing? Is there veteran benefits that we need to look at and examine? Are there funeral arrangements that have yet to be established? But more than that, it's really kind of meeting the family where they're at that exact moment and getting them to a place where I always say, after my 20 plus years, of an easy death, where all those pieces have sort of been wrapped up and the patient really has addressed all those things that need to be done, so that at the time of death, it's seamless and it's peaceful. And that's really what we want. So, we always think that it's just about the nurse or it's just about the medical team, but a lot of times for patients, it's about spiritual needs that they want to address. Maybe it's the relationship with their idea of a higher power that they want to kind of uncover. And that's when the spiritual team comes in. So it's really what the patient needs at that last few months of their life. And that's what the hospice team really does to support the patient and the family.
Well, and I that's a very important aspect, the services that are provided for the family, certainly, and for the patient. Having experienced hospice when my mom passed away, the material they left for us kind of helped remove the mystery of what this process was like. The counselors and the social workers helped us through a lot of things. So it's almost a gift. And I know Christine and I had spoken earlier, we see so many people now waiting until the last few days before they pass, before taking advantage of hospice. And so the family is missing out on that. Some of the things you mentioned, the class I talked about, Aging Mastery, hopefully they took that and covered those things. But so many people, because of the fear of death, have not taken care of their final arrangements, or what they're going to do with their possessions and those sorts of things. And if they can be helped with that through the last months of their life, it's a gift not only to the person who is in hospice, but to the family. So the person's passing is so much easier.
And Jack, if I could touch on one other thing is, we as soon as that time of passing, then the bereavement team steps in, right? And we follow that family for 13 months. Because that first year after the death of someone we love, there's a lot of like the unanswered variables. The first Christmas, that first birthday, and we offer then a bereavement team that's there just to support that family through that year and get them to that sort of next phase of their life, out of that mourning phase, back to that sort of place of where everything seems okay, because when you lose someone you love close, it feels like you're painting with a hammer, and so we want to get them to a place of sort of acceptance and peaceful. And so it's like that whole process. So it's, as soon as the patient dies, we don't just say, okay, thank you, we're sorry for your loss. We're then with the family for 13 months as well, which is really important.
That is very important. Families, a lot of times they're resisting the passing so much that they haven't worked out how they're going to deal with the fact of that. And to have that support there is also very important, because so many people process death in different ways, and having an expert there that can help them process it is really important. So if someone wants to contact Terra Healthcare, how would they do that?
The best way to get in contact with us is to call us. Our phone number is 760-904-6070. I will most likely be the person that answers the phone, but if not, you can ask for me. My name is Christina. We will work with you, work with your family. We will get whatever we need. We work closely with doctors, offices, hospitals, and facilities. So we'll get everything started and have that conversation, whether it be for home health or for hospice.
So one more quick question. We talked about these services being provided or being covered by Medicare. If a person is younger and doesn't have Medicare and needs these services, is there private insurance that will cover it?
Yeah, so most commercial insurances will cover a large percentage of the cost, both home health and hospice. That's just a call that we would make to get the authorization to ask those questions. And then if you have a Medicare Advantage plan as well, they typically offer even more coverage.
Okay,
So
thank you, because I was going to talk. There's so many permutations of Medicare, so yeah. I'm glad you mentioned Medicare Advantage. That's part of what's offered under Medicare Advantage as well, yes. Not just primary or standard ordinary Medicare. Why don't you tell us that phone number one more time so people can get that information down?
Mm-hmm. It's 760-904-6070.
So Stephen, Christina, anything more you'd like to add to our conversation?
Yeah, I think the one thing I would, if you're watching the video and you're kind of wondering, like, where are we in the process? Where are we, you have a loved one and you're not sure, like you're seeing maybe some hiccups, memory loss, confusion. Where are we in the process? I always say, give us a call and let us just talk you through where you're at in the process. And that's really, Christina and I, she works really closely with me in the social work team about like, how can we help you? Maybe it's not your time for home health and hospice, but what other services are in the community that may benefit you? And we don't mind being that community partner. We want to partner with the community and get you to those sort of services that may help you age. What I always say is how to age in place successfully. And so, and if you are at the place where, then it's time to start talking about, you've gotten a bad diagnosis related to cancer, then when do you have a hospice conversation? So I always think it's okay just to call and talk, and I think that's important.
That is important. That's great that you offer that, because so many people just don't even know how to begin to approach some of the things we've been talking about. Like I said, we offer classes about it and to help people prepare for what it takes to grow older. There's that quote, I'm probably getting it wrong, but it's a lot harder than we thought when we were in our 40s, I'll tell you that. So again, I want to thank you. It's Terra Healthcare. And again, they can reach you at
760-904-6070.
Well, Stephen and Christina, I want to thank you so much for joining us this morning. We really appreciate it. And I want to thank our listeners for joining us this Friday. Everyone have a great weekend. And you, Steve and Christina, you have a great weekend.
Thank you.
And for our listeners and viewers, we will see you next Friday with Joslyn Television Interview Fridays. Thanks and have a great weekend. Bye-bye.
Thanks. Bye-bye.